So before doing any procedure, check the patient's chart as well as the physician's order. Do the hand washing and identify your patient and introduce yourself. Good morning, ma'am. My name is Razel Cadalin from Foundation University, and I will be your student nurse this morning. May I know your name, ma'am, and your birthday?
Michelle Cadalin in May 18, 2007.
Okay, may I see your wrist? Okay. So, ma'am, we will be assessing your mouth, nose, and sinuses in order to identify if there are any abnormalities. In order for me to do it, I'll be needing your permission since I will be touching the part of your face. Is it okay with you, ma'am?
Yes.
Okay. So, ma'am, I will be leaving the room in order to gather all the necessary materials. And if you want to use the toilet, you may do so in order to avoid any interruption while we are doing the procedure. Going back to the patient, we have to identify its name again in order to confirm. May I know your name again, ma'am?
Michelle Cadalin.
Okay. So, after that one, we have to provide privacy to the patient by dropping down the curtains, and then we have to provide examination gown. So, assuming that I already provide an examination gown to the patient, so it's now time for me to take subjective data. Ma'am, do you have pain over your sinuses?
No.
Do you have frequent discharge
No.
within your nose?
No.
Okay. So, do you have dentures?
No.
We will be inspecting the external nose of the patient. So, upon inspection, there is no lesion and there is no swelling. And the next one is we will be checking the patency of airflow through the nostrils of the patient. So, upon checking, the patient can breathe properly. Next one is we will be inspecting the internal nose of the patient. So, upon inspection, the internal nose of the patient, the color is pink, moist, nasal mucosa with no discharge, no bleeding. The nasal sputum is in the midline. It is intact. We will be palpating the external nose of the patient. So upon palpation, the nose of the patient is symmetrical, smooth, external nose with no deformities or tenderness. There is no discharge. So next one is we will be palpating the external nose of the patient. So upon palpation, the nose is symmetrical, smooth external nose with no deformities. There is no tenderness, there is no discharge, and there is no swelling. So next one is we will be palpating the sinuses of the patient. Ma'am, just please tell me if you feel pain when I palpate your sinuses. Is this painful, ma'am?
No.
Okay. So upon palpation, the patient verbalizes that it is not painful, and upon palpation, there is no swelling and there is no tenderness. Next one is I will be percussing the sinuses of the patient. Ma'am, just please tell me if you feel any pain. Is this painful, ma'am?
No.
Okay. So upon percussion, the patient verbalizes that there is no pain. We'll be assessing the mouth and the throat of the patient. First is that we will be inspecting the lips of the patient. So the lips of the patient is not cracking, it is moist, and the color is pink. There is no lesion and there is no swelling. Next one is we will be inspecting the teeth of the patient. Can you open your mouth, ma'am? So the teeth are all in good condition. It is 28. The color ranges from white to light yellow. Smooth surface and has a shiny enamel. Next one is we will be inspecting the buccal mucosa. Ma'am, can you please open your mouth again? Section, the buccal mucosa of the patient, it appears moist, pink in color, without lesion. There is no swelling, it is soft. So next one is we will be inspecting the Stensen's duct of the patient. Open your mouth. So upon inspection, the duct is smooth, continuous tube with a diameter that varies along its length, typically ranging from 0.5 millimeter to 1.4 millimeter. Next one is we will be inspecting and palpating the tongue. Can you please take out your tongue, ma'am, like this? So upon inspection and palpation of the tongue, there is no lesion, there is no swelling. The color is pink, moist, and symmetrical with a rough texture due to papillae. Papillae rather. Assessing the ventral surface of the tongue, and then I will be palpating the area. So upon palpation, there is no masses and then there is no tenderness. Is we will be inspecting the Wharton's duct. So upon inspection of the Wharton's duct, there is no swelling and then there is no redness, there is no pain, and then there is no tenderness. So ma'am, we are now done with our assessment. Do you have any questions before I leave?
No.
Okay. Ma'am, I can assure you that all the data gathered is highly confidential and it is only between you, me, and the physicians. Remove the patient's gown, assuming that I already removed the patient's gown. So I will take my take off my gloves. Then I will do the hand washing, and then after the hand washing, I will document the findings.